Today we are back with Real Talk with Reese, and I'm gonna tell y'all something. Y'all know I'm always a vibe. It's always a great day and a great time to be here on Saturdays with No Static Radio family. Glad they are my family because I needed them today. I'm just let y'all know I'm gonna push through this show because that's what I do. And but we're gonna do this as a part one and a part two because I want these ladies to have the Real Talk with Reese vibe. But the whole point of having it called Real Talk with Reese is because we stay real in here. And this morning, unfortunately, or this afternoon, right before I walked out the door, I heard the most devastating news, and I'm not gonna say any names because I don't even know if everybody knows in the family yet. But one of my bestest friends, closest friends, they're not my friends, my family. Son passed away this morning. Announced dead this morning unexpectedly. It is the saddest. It's a really sad day. So I'm gonna push through, but this is how God works. This is how God works always in my life and in life period. That's why I talk about alignment. I talk about being totally focused in life as far as being on your journey, your path, and just really living your purpose. And my purpose is not always fun because God always. This been a week. Like I literally had two phone calls this week where I had to jump on to coach someone down from suicide twice this week. And I was like, and I literally, you got to be careful what you ask for because I said Friday, that's it. I was like, that's it. I ain't no more. Don't. I'm not answering my phone. I'm not dealing with no more sadness. That's it. It's just it was draining, and here we go. But the light, the shine. I can't think, y'all. I can't even get my words together. But the shining light, I guess I would say, and the good part about it today is that I have three super amazing women here today that are all about mental health. That this is their career. They deal with trauma. They deal with mental health. They eat, sleep, and breathe this. They have so many tips. They're so intelligent and they can help. This is what they do. Is their passion. And couldn't be the best thing or a better day to have them on the show than the day when I need them and the family needs them and they can go back and watch this or anybody that's going through it because there's so much going on. Um, I always want to be a positive about. I can't stand to talk about sadness, especially on the show because I just want to uplift. But today, this is what God has me doing, and so I'm going to introduce these beautiful ladies today, and thank you guys for being here. Wow, we was about to. Let me tell y'all something. We got a lot of great stuff coming up, and we probably do part two next week if they're available, so we can just get into all of that too. We're going to eat afterwards. We're going to have fun today, and that was just not part of God's plan. But I appreciate you being here. So we'll go on down the line, and everybody just introduce yourselves. Um, I know you guys been. I've been in a lot of DMs, and people are excited about mental health because so many people are going through it. Um, so, Brandy, can you talk about who Brandy is, your title, what you do, and your passion in life?
My name is Brandy Hill. I'm a psychiatric nurse practitioner. I've been a nurse since 1996 and recently became a psychiatric nurse practitioner. And I did that because no matter what level of care I worked in nursing, mental health always got the short end of the stick. There's a stigma about mental health, especially in our community and our culture. And I wanted to embrace it and take on the challenge of educating my community and uplifting us, empowering us, and giving my family, my friends, my community the tools that we need to make sure that our mental health is also top of mind with our physical health and well-being. Because the brain controls everything. It tells you when to breathe, it tells you when to sleep, it tells you when to eat. And if your brain isn't right and not functioning at all cylinders and firing those neurons and those neurotransmitters, we cannot be the best we can be. And it's actually taken 10 to 20 years off our lives if we don't have the capacity and the mental health and wellness that we need. So that's what I'm about, and that's why I'm here today. So thank you for having me.
Awesome. She's so cold, y'all. Such a wealth of knowledge and just a beautiful spirit. So you'll see more of that as the show progresses. And then we have Tiffany. Tiffany, tell everybody about you. Yeah, welcome Tiffany back. Girl back, you know, saying she a reoccurring guest here, you know, Static Radio.
I will come anytime you will have me. Thank you. My name is Tiffany Harris, and I'm a licensed practical nurse, and we deal with mental health every day um, in facilities. We see people just actually drugged up, and it's more than just give somebody a pill, and that's what I'm all about, the holistic approach of the body, mind, and soul. To help when we need, like Brandy said, the brain controls everything. If something was wrong with our heart, we would go see about our heart, our lungs, or whatever. And your brain is a organ too, as well. And we have to take care of it. And the stigma has to stop. It's like becoming too prevalent to ignore, you know. So thanks for having us.
Oh, I'm so glad you're here. Like, you're so cute. I'm so cute. And then we have the fabulous Rashonda. Can you introduce yourself to everyone?
Yes, hello everyone. I am Rashonda Jackson Burks. I am a certified trauma support specialist. And I have over 27 years of dealing with people in crisis. And when I left my former career, I understood that people in crisis are, a lot of them are dealing with, they're battling things in their mind. So this is what's causing their reactions and behavior. All behavior is communication. No matter what you're doing, when your behaviors are communicating something. And so when I got into trauma, it's just my thing. I love to talk about it. We have so many generational things that go passed down our bloodline, and we just need to learn how to break that thing and understand that it's okay to ask for help. It's okay not to have a great day. It's okay not to carry the world on your shoulder. But so many people, as Tiffany said, don't want to say anything because they don't want to be labeled as this person who's weak. And so my goal is to understand trauma and let help people understand trauma so that they can heal. We all need healing. Every last one of us in this world needs healing from something. But you can't heal it till you name it. You have to put a name to it. You have to understand it. So I'm all about helping people get better, helping generations get better.
And so that's awesome. So we don't really tap in. I mean, one of the reasons why this, and I'm sure a lot of people know, but if you didn't know, one of the reasons why this is near and dear to my heart and why almost every single show I find a way to talk about mental health, and I have multiple shows about mental health, is because I experienced it with my son who was a junior in college. And he called me one day and he was talking crazy in my mind. Like he was talking, I don't even like to say that word, but he was talking like he doesn't usually talk, like saying weird stuff. And I'm like, oh, he came home with his college friends. They supposed to be smoking and doing some drugs or something. I'm going off on the phone like, what's wrong with you doing? What y'all been doing? And he was just like saying, just nothing made sense. So, make a long story short, um, by the time I was able to get to him, because the ambulance came, because he had, he kind of got out of control. And when I pulled up, the ambulance guy said, "Oh, this is mental health. Like this is mental health. We're not going to charge you with anything because he had become violent." And I said, and when I say y'all, I went off on that guy because I was like, mental health, like because in my mind, you should stereotype of my son. You don't know my son. Like my son is in college. There's not no mental health. And he was like, he looked at me so sad. You could see it on his face. And he was like, it's mental health. That's why I'm not gonna charge your son. He said, but I understand, like, but you couldn't. How you gonna tell me that? Because he was a junior in college, and I raised this child, and he was fine. And I'll be honest, for the longest, after we went down the road and he was diagnosed bipolar schizophrenic, I didn't tell my friends. I told my friends he was having seizures because the stigma. It wasn't necessarily me being embarrassed, but I didn't want that on his life. Like I didn't want people to judge him. I was like, they never gonna treat him right. They don't like, oh, he bipolar schizophrenic, not gonna be around him. Like it was so hard for me to internalize that my child was bipolar because you got me. I never experienced that in the black family, in the black community. They're just like not normal. They don't function. We would say that's the crazy uncle. Well, that crazy uncle probably was not the crazy uncle. He never got help.
Right.
So thank God, my son was in a mental hospital for 4 years, in and out. I was saying, we loved him through it. We went to many doctors, and what I didn't like, which I would like for you guys to talk about, is how the drugs that would just give him and didn't care about him. Like they just throw him on something. He was walking around like a zombie, but I would not give up. And they just told me this was gonna be his life, and now he's fully functional. You wouldn't know it. If you met him, you wouldn't even have a clue. He was definitely on medication, but it took a long time to find that right medication. But the key and the thing that I always try to get out to everybody is, to me, it was, I loved myself, son, back to health. Like, because my family got together, we band together, like, we not giving up on him. And I just kept going. I didn't just let the doctors tell me anything. And then I found the right doctor. It was an Indian doctor in Atlanta, Georgia. And she said, he could be fine. He had taken off all of that stuff that's killing him. And she said he was on lithium and it was so strong. And he just couldn't. So then when she told me about he got a shot, it changed his whole life. He was able to function. But I will tell you, if he don't have that shot, it's it can be traumatic for his life, right? But the key is to all of us is just don't give up. Like you gotta find the right thing. We just think mental health is done, but it's not. They can be fully functional. And so let's talk about that. Like, Brandy, I know you deal with this a lot. So what they just go, how do you determine like the medication and when they come in, like it's, to me that is the work. The stigma also is that the doctors seem like they don't care.
So I work at Highland Springs. It's a mental health hospital near the Beechwood area, and I work with the sick of the sick. I cover 2 units that deals with suicide and psychosis, bipolar, schizophrenia, depression, eating disorders, you name it. And psychiatry is a specialty. A lot of the patients that I work with are going to if they're getting care, they're going to their primary care doctor who are good at what they do. But psychiatry is a specialty because we know about what neurotransmitters are being affected, what diseases cause certain symptoms, and the key is diagnosing your patients correctly. So I pride myself on digging a little bit deeper to look at what the true symptoms are so I can put them on the right medication. People come in, they have a stigma regarding mental illness. I give them a bipolar diagnosis. I'm going to use that as an example, and they cry. And I tell them, don't cry. Work with me. Let me help you. You can have a good quality of life. We're going to find the right medication for you. And I start off doing my assessments as to asking them, number one, what brought you here? What triggers do you have? Even though I have it all on paper, I want to hear it from them and what their perspective is. Then I dig deep into, do you have a mental health provider? Some do and some don't. What medications have you been on in the past? Do they work for you? Why don't they work for you? Because this is their treatment plan. This is their life. And I want to be a key component of giving them the right treatment and the right quality of life, understanding what is important for them. So when I'm selecting a medication for them, I'm looking at what side effects that they're concerned with. If they're a married man, they can still be sexual and loving and have emotions with their family and their wives and things like that. So that's the first thing I look into to see, okay, what's important to you so we can come up with the right treatment plan, target those symptoms, and get them back functioning because it's all about quality of life and you can have that quality of life. I'm really into the long-acting injectables like what you mentioned with your son. A lot of times you get the patients, they're feeling better, they feel like I'm good, I don't need this medication. Yes, you do. This is a lifelong illness. I have high blood pressure. I'm always going to have high blood pressure. I exercise, I eat right, I drink very little.
Right, because you look amazing. See, this is something, I'm glad you brought that up. Because I don't know if y'all can see her, but she look good, y'all. She look good. And you wouldn't think that we think high blood pressure is like you eat poorly or, overweight and stuff like that.
I exercise every day. I keep my calories low. I try to drink plenty of water. I drink very little alcohol. I don't smoke cigarettes. But my blood pressure was sky high. And it took me multiple medications. I take 4 medications a day to keep it together. I have to eat right. I have to exercise right. So I tell my patients, do you think I want to take 4 or 5 medications a day? Last year I wasn't taking any medications. I took vitamins. I don't even take birth control pills when I'm trying to keep myself as healthy as possible. But I use that as an example and I share that with them to to let them know, if you look at me, you think I got it all together.
Absolutely.
But I'm sick, and if I don't take care of myself, and it's genetic, and just like mental health, it can be a genetic component. There's so many factors. So let's get rid of the shame. Let's get rid of, the stigma, and let's look at how we can be healthy and whole. And medication is just one component. Like I tell my patients, there's no magic pill. I'm going to help you target these symptoms so you're not feeling psychotic, you're not hearing voices, you're not seeing things that aren't there. Your mind isn't racing, you're not having periods of mania, but there's things that you need to do too. You need to eat right, you need to have a good support system. Like you say, you love your son back into health. A good support system and having someone you can go to when they're having a bad day.
Yes.
So it's a multifaceted approach, right? It's not just take this medication and you're gonna get better. It's holistic. So I empower my patients, I educate them at every chance I get, because the time that I have with the patients that I take care of inpatient is a 5 to maybe 10 day stay. And people say, well, what can this medication do for me in that short amount of time? So I educate them. I'm a little bit more aggressive because they're acutely ill. But when they leave, they're feeling better. They're loving me, they're thanking me, their families are thankful. So this can be done. But as a culture, as a community, we need to wrap our heads around this and get rid of the stigmas. I have some key points that I want to talk about the history of how this stigma came about, because it goes back into the ancient Greece and the Nazi regime. I mean, it goes back where people were getting labeled and actually branded with tattoos and being burned. So when you see them in the community, they could identify you. And there was something morally wrong with you, and they would ostracize you and chain you up until before there was an institution. So we've come a long way, but we got a lot of ways to go. And a lot of things that we're seeing socially, on the news, people just shooting up everybody. A lot of this, if you don't love yourself and you don't value your life, how are you going to value someone else's life? So that's just a little bit of why I'm doing what I'm doing. And I feel passionate and I feel fortunate. I feel like it's a calling and it's a ministry for me to be able to love these patients. And even though that they're psychotic, they know that I love and I care for them.
That's so important. Like, you're a blessing, because that's what I saw it like firsthand, that the love and care and making them feel like it's okay where you're at. Because first of all, let's keep it 100, y'all. Every last one of us got some mental health, okay? Everybody got some kind of mental health at one point in time. You went through something, some kind of sadness, some kind of grief, and I definitely want y'all to give me some tips for people that are going through like grief. But the stigma is the biggest thing. Like, it is really a big. People are afraid to talk about being bipolar, and I know it's so many levels. I wish you're saying bipolar, but I know he's like, my son is bipolar schizophrenia. There's bipolar. It's probably like so many manic.
Depression.
And there's different episodes. Like patients come in and they're in a depressive episode, or they're in a current manic episode, and there's patients that are schizoaffective bipolar, schizoaffective depressed. There's just so many different diagnoses.
And like I never knew, and y'all can let me know if this is real, but doing my research, I realized OCD is a mental. Who would have thought OCD? Like, people need to know that, but it makes sense. Because I know people that are OCD, and they really do. Like, if you cannot function because something out of place, and it really affects you, it makes sense. But I know people like that. And then when I was like trying to help my son, I was like, OCD is a mental health. Like, people don't even know that. Like, that's something that.
Since you mentioned that, let me segue into the 10 most common mental health disorders, things that you wouldn't even think of.
Okay.
So, anxiety, depression, PTSD, ADHD, OCD, eating disorders, bipolar disorder, dissociative disorders, where you're so stressed, your body, it's like you leave your body, things aren't real. You're viewing yourself there, but you're not within yourself. Schizophrenia, addiction, and substance abuse. There's so many people that are self-medicating because they're trying to soothe these symptoms. So a lot of my patients have codependencies where they're mentally ill, but they're also on a substance because they're trying to self-manage, they're trying to self-soothe, they're trying to self-medicate. So a lot of times you see the methamphetamine users that are actually trying to treat bipolar mania or ADHD, and that they don't even know why they're gravitating, but when they hit that meth, it makes them focus, it makes them calm. So they keep going back for it. People that are depressed, you know, reach out for an anxiety, reach out for marijuana because they're trying to soothe that anxiety. They're trying to sleep at night because a lot of times you can't sleep and you don't know why. And a lot of times that insomnia is linked to a mental health disorder. It's depression, it's anxiety. So it's just certain things I ask you. How are you sleeping? How are you eating? You know, do you have racing thoughts when you go to bed at night? What's keeping you up at night? So just certain questions I ask help me uncover a lot of symptoms, and it's what I call their baseline. They don't even know they're depressed because this is their everyday, where they don't want to go out, they're isolating from their family, they want to be social, but they decline a lot of invitations because they're anxious.
And that's a.
I want to say too, in addition to what Brandy is saying, most people self-medicate because the medications have side effects. So if I'm taking a medication and it's going to make me gain 100 pounds, I may not want to do that. Or if I'm taking a medication, as you mentioned earlier, that's going to make my sex drive, diminish my sex drive, I'm not going to take that.
Yeah.
But I know what this alcohol does to me. I know what this marijuana does for me. So that's where that self-medication comes from. And then all of a sudden it's out of control. So now you have a mental illness and addiction. So that's dual diagnosis, right? So that's a lot of reason too why people because if you think about it, when they give me an antibiotic, I always tell them to give me 3 days because I'm not going to make it to 10. And I don't have a mental health disorder, right? Because you just, medication is, think about it, you have to take this every day for the rest of your life. It's just not, it's not conducive for everybody, right?
And where we are today, we're really fortunate that we have the science and the technology that we have because there's like over hundreds of mental health medications. And because of that, when I communicate with my patients, I can focus on what they don't want so I can pick the right medication for you, right? If you're worried about weight gain, I can find something that's going to treat your bipolar disorder that will decrease the opportunity of you gaining weight. If you're not eating and you don't have an appetite, I can find a medication that's going to boost your appetite, help you gain a little bit of weight, help you sleep at night. So we have so many options. So I tell my patients when I'm with them, I'm your advocate. Let me know what you need. Tell me everything so I know how to properly treat you. Don't hold back. You can curse, you can scream, you can do whatever you need to do. Just communicate with me so I know what you're dealing with. I know what's on your mind so I can best treat you. Because this is your treatment plan. And I want it to be patient-centered, that's created just for you.
And
not for your neighbor.
That's a blessing because that she has a heart for that. And that's what I love about her. She's not just shoving the medication and saying, let's see what this does. She's trying to find out as much as she can about the person, and that's beautiful because everybody doesn't get that. And it's unfortunate, but we need more practitioners like yourself.
That's the key. I can tell you.
Yeah, absolutely.
I told y'all for 4 years. My son was in and out, different hospitals. Then my mom was like, move to Atlanta because all the family's down here and we're just going to get them together. My mother was like, I love her to death. But she was like, oh, I'll fix them, bring them here. So we go down there and all these. It wasn't until the one India, okay, caller on the line. Who's calling? You on with Real Talk with Reese? Oh, I forgot. 1 second, caller. Yes, and you guys, the number is 216. We lost him. Oh. Hey, caller, who's on the line? You there? I can hear you. Who's on the line?
We hear
I can't really hear
you.
you.
Can't hear us.
Right. Are my phone?
What's the number, Tommy?
So the number is 216-939-5087. Call in with any questions. And if you're there, caller, did you have a question? You hung up. Okay. Call back. We had a little technical difficulty. We definitely want to hear anybody that has questions. and you are not able to call in, you could definitely DM. We're gonna do a part two. I'll let you know the date of that so we can, get it in. Because I had so many people calling and DMing me about this topic because everybody knows somebody that's going through it, even with themselves. And like, um, let's. So you are a nurse, right? So
Correct.
people come in, you dealing with everything, not just mental health, just
Correct.
everything. Are you able to identify when somebody comes in and you like, this is mental health? Like,
Absolutely.
do you refer them there? Because that's what I noticed. Like, people go in, and then a lot of nurses are doctors too. Don't refer. They see an issue, and they just deal with it's high blood pressure. But you clearly see that there's some mental stuff going on. Do you take time out to refer them?
Absolutely, and that's just the thing that Brandy, Rasheed was just talking about. Like, you have to care. You know, everybody is busy. You know, but you can't just shove a pill down someone's throat. You have to recognize that's part of the job. You have to recognize what's going on with your patient holistically. I keep saying that because you have to look at the whole patient, and you have to give them. Nurses are educators, so you have to give them the tools that they need to help themselves. And you recognize, like Brandy mentioned, sometimes they don't even know that they're depressed.
Okay. Caller, you on the line? Hello. Thanks for calling to Real Talk with Reese. What's your question? So you're saying we don't recognize it because what again?
He said we dismiss it.
Oh, we
He
dismiss
said,
it.
and that's what makes it worse. We kind of see it as something jovial, or we dismiss it and don't address the problem.
It's a crazy uncle, or the crazy auntie, or the crazy cousin. What we have so much fun with. Well, it's fun to us, but they're actually going through something, and we don't see it. We don't recognize they're actually dealing with something they don't know how to handle, and so we never get them the help they need.
True. I agree, and that's one of the reasons why we want to talk about today is trying to eliminate that stigma. Just like Brandy was saying, she has high blood pressure, so high blood pressure is something that she has to take care of. Our mental health is still, a disease that we have to take care of. It's the same as having heart problems or being diabetic. We have to normalize that in our community and start talking about that because like everybody has something. Everybody has something going on.
And one thing that people don't realize is with mental health, your brain suffers from damage. Every time you have a depressive break, periods of mania, you're not treating that schizophrenia, it's taking 10 to 20 years off your life. Your brain does not regenerate like other muscles and bones in your body. I tell my patients, you not treating your depression is causing scar tissue on your brain. And that cognitive function you will not get back. So the people we see on the streets that are talking to themselves and that, they are suffering cognitively. And your brain doesn't regenerate. Like if you break a bone and you're in a cast, your muscle shrinks, it atrophies, you can go to physical therapy and you can work that back. Can't work your brain back. Every time I see a patient, they relapse. I have patients that have been in my facility like 50 times. Every time you relapse, you lose 12 cc's of gray matter in your brain. Your brain is about this big. 12 cc's, which people don't realize, is like maybe a part of a shot glass, but your brain only has so much gray matter that never regenerates. So every time you have a depressive episode, or you're having a manic episode, or you're having psychosis and you don't treat that, you're losing brain tissue. You're losing cognitive ability.
I think if we get that message out, that'll wake some people up because
Yes.
So that's deep. That's really deep. So because I know some people that I have a friend that's always depressed, and she, her depression she goes to the bar, you know, and drinks it. And I know, you know, it's obvious that she even says that's what it is, but I don't think she feel like she can get out of it. But that's one of those things where you just keep going to. You can go to a therapy, but I always say you need more. You need some medication. Um, so every time she's letting this depression go on, her brain is deteriorating.
Yes.
So
Oh
Brandy,
my
let me ask you this.
gosh.
So when I think about that, when you were talking about that, and I think about you saying people lose the gray matter in their brain. So I automatically went to, could that trigger things like Alzheimer's,
Yes.
dementia?
Oh,
Yes.
Okay.
Cognitive decline,
yes.
and that's just
Wow.
one example
Yes.
of that. But yes, like people that you notice that are schizophrenic and they can't talk, they can't take care of themselves, that's a cognitive decline because they're losing brain matter. They can't take care of themselves. They can't dress themselves. They can't bathe themselves. And I mean, that's to an extreme. But I had a friend who has 2 children that suffers from mental illness. They're both schizophrenic, bipolar, schizoaffective disease, bipolar. And her daughter told her, she's like, Mom, I just feel like my brain is foggy. She's like, I feel slow. And I explained to her, she's losing brain function. She's not compliant with her medication. She takes her medication every now and then because she's 21 years old. She wants to go out and drink and have fun with her friends. So I told her, get her on a long-acting injectable. I'm about harm reduction. I don't want you smoking weed. I don't want you drinking with your medication. But if you're going to take your medication, I'd rather you take your medication, go get your medical marijuana card, let the doctor know I'm taking this, I'm taking that, I have certain diagnoses. That way it's a holistic approach so they can continue to take their medication. Because that brain function, you're going to lose it, the damage is going to continue, and she's 21 years old. And I told her in the next 20 years, what kind of quality of life is she going to have if you don't treat this?
Oh my God.
On top of the alcohol and the drug use. I mean, just think about it. So she's up against the 8 ball. You know, how
And that's
successful
the
she
sad
will be.
part.
See this
21
regularly.
is young. They want to be.
And that's what it takes. When you're girls, it's 18 to 25 when you start noticing this. When you mention your son was in college, that's when everything starts to
That's
happen.
what I learned.
That's when they become suicidal. They become depressed because that's when everything peaks, right? So you're going to see, and we think, okay, it's just life stressors. You're learning how to live. No, there's other things that are going on, and we need to kind of hone into it because it's just not normal for them to function this way, and it's not going to go away. Unfortunately, I love prayer. I love God. I'm very spiritual. We can't pray this away.
You cannot. Let me
And
tell you
God
something, because
created
I had the
therapists,
world
God
praying for
created
my son.
nurses, God created
this
people
science.
to
That's a good
intervene.
point.
So,
God
you
created
know,
this science,
absolutely.
so we can have the best of the best in all areas of our life, you know, and that's why he's creating people like me, people like Rashonda, people like Tiffany, people like Tania, because we all have certain strengths. We all have something to bring to the table. So this is why we're so far along in our technology and our science today, so we can get what we need and we can continue to flourish and grow and uplift and empower each other. So prayer is the way I cope. Because like you said, every day, if somebody tells you they're not dealing with mental illness, they're lying to you. And I tell my patients, because they're like, oh, you're so put together, I said, honey, I just look like this. I paint my smile on with lipstick certain days. But I have my army, I have my people. I have certain things, how I cope and how I get through this. So I can be the best I can be for you.
It is really important, guys, to really have a good circle. You gotta have people that really love you around you. And people always say, I'll be good by myself. No, you won't.
You'll die alone.
Yes, you will die,
Yes.
Brandy. I love that.
You'll
Yeah,
die
another
alone.
caller?
I just want to say, when you say you'll die alone, I worked the psych unit, and when you have young people, especially in their early 30s, who has not been treated properly for their mental health, they have nobody that comes and sees them, visits them, knows anything about them, because that's where the mental health has taken them. So it's definitely important that you have a circle, and it doesn't take a whole lot of people to have the circle.
And
You just need the right people in your life.
we have a caller on the line. Caller, are you there? You on with Real Talk with Reese?
Say it again.
Caller, you on the line? Real Talk with Reese?
yeah, I'm still there. I was just trying to touch on, you know,
You were touching on what? Okay, so this is one of the things that I think is important. And I say this all the time to y'all, to the world. Like, seriously, if you see a friend, like, we got to be responsible. If you're a good friend, if you are, even if it's a coworker, but you don't have to take all your time out to help this person, but sometimes just reach out. If you have a cousin or a friend or your mother or anybody, and you all of a sudden see that they're having real big changes, they're not coming out, they seem sad, or even if you see somebody like out of the blue just gain a whole lot of weight or lose a lot of weight, like there are things that if you really care about somebody, you pay attention, you could see some signs. Just reach out and just say, hey, are you okay? Don't call. And another thing is, like, I think it's important too not to just say, hey, are you okay? Because they'll say, I know I was like that. I wouldn't even answer my phone when I first had lost my job because I didn't want to talk about it. So my friends popped up on me. They was like, "What? Where you been? What's going on?" You got to be that friend. Like we have to do this as a village. You see somebody going through something, don't just do that. Say, "Hey, let's go to lunch." Like take people out. Like get to try to see what's going on with them. Maybe even just send them some tips. Share what your story because I think that's what helps a lot. Is when I start sharing about my son. You know how many people start saying, my daughter has that too. My cousin had my mother. I grew up with my mother like that, and we got to talk about it in our community, and we got to talk about it a lot, and we got to share it and talk about it with empathy. And also talk about it like it's okay, girl. It's okay. It's okay to have mental health issues.
And when you say that, it makes that person feel comfortable.
Yes.
Okay, wow, it's not just me. Look at her. Look at what she's doing, and she's dealing with this. So we have to share our testimony. We have to share our story with people because it helps them to open up.
Yes. I share with my patients, not to get too personal, but I want them to know I'm a real person too. Mm-hmm. And just because you see me wearing this white coat and you think that I'm all put together and I got it all together, no, I don't. And I share things about domestic violence abuse, what I went through, teen pregnancy, depression, my health issues, to let them know you need to take your medication. I take mine. I have a routine every day so I can stay on track. And let's talk about some of that shame. Shame, guilt, worthlessness, all of those are key signs of depression. It's a disease process. And some people are passively suicidal. They just feel like things aren't going to get any better and I don't have a plan, but if I didn't wake up tomorrow, that would be okay.
With that.
Yes.
That is depression. And if you don't do something about it, it will manifest into actually creating a plan because it's so quick and it's so spontaneous that one day it's like, you know what? Okay, I'm going to climb up on the roof and jump off. Do you know how many people that say, and I'm like, where are these trains? I'm going to walk in front of a train, or I'm going to walk out in traffic, or I was actually on the roof, but I climbed back down. And it's like, they don't think about this for days and days. It's a sudden instance. It's one thing that triggers them where it's like you're all the way to the top and one thing just sets you off. So it doesn't really take a lot.
It doesn't. And they may have thought about it before, like you mentioned, but then something happens and boom, we're here.
It could be the
How do we
smallest,
get here? Yeah.
the smallest thing. Nothing, like, because when most people, they say, well, what happened? You know what I mean? What could have happened? But you never know. It could have been because they couldn't get the cereal box open. Or, I mean, seriously, something that simple. To just say, okay, I'm done.
It's a buildup of things. It's not just one particular thing, but they feel so hopeless, like, and why should I carry on? This is my life. And I tell them, you don't have to have this life. You can have a good life. Work with me for a little while. Let me show you, there's proof, there's evidence. I work in evidence-based practice where there's science, and because this medication doesn't work, let's find out. So let's try something else. So I start off by telling me what did not work for you. What have you tried in the past? Because I don't even want to waste our time on this.
Yes, that's important.
We don't have, because I feel like you're here, you're in my hospital, this is a 911, you're in crisis, and I want to stabilize you as quick as possible. Then I'm going to transition you to an outpatient provider that's going to continue the work because this is going to be ongoing. And I condition them to let them know Just because you're feeling better doesn't mean you can stop this medication.
Yes.
You need to get in therapy, you need to exercise, you need to sleep right, you need to eat right, you need to take your meds. If you like going to church, you need to go to church, you need to get involved in a church family, whatever your faith may be. If you're not a spiritual person, that's okay too. What motivates you? Let's get motivated so we can have a good quality of life because it's possible.
So you deal with the trauma.
Yes.
So what is that somebody coming in and just got hurt, lost a leg?
No,
What does that
trauma,
mean?
I'm talking psychological
Trauma.
trauma. So
Okay.
those are those things that has happened to you either as a child that you haven't dealt with, and now you are in a situation mentally, and also trauma can affect you physically. Because what happens is if your body is under extreme stress all the time, we talked about, like Brandy mentioned, PTSD. If your body, our bodies are not supposed to be under extreme stress unless there's a stressful situation. If we're just sitting here and we feel comfortable, some people are literally, their bodies are on heightened alert. So this is where you get the depression, the high blood pressure, the kidney disease, the diabetes, and all of that stuff can manifest from trauma that has occurred, that has happened to you, either as a child or even as an adult, because trauma changes your brain. Our bodies are designed, our brains have a mechanism that tells us when something is dangerous and when something is safe. But if I have experienced extreme trauma, chronic trauma, I'm always looking for danger. So I'm never comfortable.
So I have someone that I guess I shouldn't say that because that might identify them, but I know someone that's really, really big in the community, and they are so paranoid all the time. And I tell her all the time, like, you got to deal with some your childhood issues. And one of her she was raped. Her mom like kind of let her be. She picked her out as a child, basically.
Human trafficking.
Human trafficking. Sorry, y'all, my mind is not good today. My words are not here, so bear with me. But she had a lot. She had to run for her life because someone was trying to kill her. She had to go to different cities. She had like a death threat on her life that didn't even have anything to her. She got caught in the middle of it. And so now that she's kind of okay and more in a safe place, but her mind is in everything, she immediately goes left. And I'm like, you're not going to get better. Just the more successful you have, you think that you're going to be okay because you're having big time success. Your career's taking off. And so you try to find happiness, but you're always paranoid.
Yes.
This is going to come to a head one day. She always looks at things like, oh no, why he say that to me? He must be after me. He's trying to scam me. He's like, and it's just the simplest thing. And I'm like, no, that's some childhood trauma.
It's PTSD.
Yes.
So with PTSD, and I say anxiety is huge right now. So I hear so many people talk about having anxiety and see it, I think, more since the pandemic to me. What are some basic tips that you can give somebody that's dealing with like PTSD and anxiety? Like some basic, I know that they need to go get deeper evaluations and take time to go and, get medication and see a doctor. But if you had to tell somebody some basic things that they can do until they can get that help, what would that be? What does that look like?
Develop some coping mechanisms and identify your triggers. Understand what those triggers are. That way you can avoid them if possible and deal with them. Because again, they're hypervigilant. They're having flashbacks. They're always in trauma mode or crisis mode. And again, that's not good for you because when your brain, like Rashonda said, is under stress, it produces certain steroids which causes damage to your brain. So even though everything that we're talking about is damaging to you, your body cannot stay in a state of stress. It's like a car, okay? If you're driving your car, you're not maintenance your car, what happens to your car? It breaks down. Same thing with the body. So we gotta take better care of ourselves. And when I get stressed and I get frustrated, the first thing my husband will say, and I love him dearly, you need to calm down. You don't want to get your blood pressure up. Because for him, he doesn't want me to have a stroke. He does not want me to be physically ill. So when he notices I'm getting worked up, you need to calm down, take some deep breaths. If we're a few minutes late, you're a few minutes late. Just calm down. It's going to be okay. And sometimes that frustrates me. Like, I don't need to calm down, but yes, I do. Yes, I do, because I can feel my heart rate going up. And if your heart rate goes up, my blood pressure is going to go up.
and sometimes even I think for a lot of us, especially women, we feel we have to constantly keep going,
Yes.
and we don't take
Yes.
the time to transition. We don't take the time to take a break. It's okay, and I think generationally we talk about those traumas and things that we've been taught. Generationally, we've been told, as a woman, you have to make sure that everything is okay. You have to keep going. You can't stop. You have to care for you, your family, and yourself. And it gets overwhelming to our minds and our brains. It gets overwhelming. So even being able to have that time where you do nothing and be okay. Self-care I'm big on self-care. Self-care is so important because I can't care for you if I'm not caring for myself.
Absolutely.
I tell people that all the time. And I will say that, the last couple of years I've been through some things, and I just kept going. I kept going, and it took somebody to say to me, you know what, you're not the same person. Like, and I'm like, what are you talking about? Like, they're like, you aren't the same person you were last year, 6 months ago. And I really sat back and I thought about that, and I said, you know what, I'm not. I'm just functioning because I feel like I have to keep going. I have to make sure that I let people know. Oh, because it was a pretty public thing, and I'm fine. I'm still smiling. You know what I mean? And it stressed me out. My blood pressure, as Brandy said, was out the roof. I'm about to stroke out over here. And because I refuse to sit down, and I tell my patients and deal with it.
Right,
So,
we had the best advice except for ourselves,
Except
right?
for ourselves.
Seriously, we really do. And that's why I always say, people say, check on your strong friends. That's real. Like, I don't even forget the strong. People think, you are the strongest person in the world. Look, that's not nothing, a title that I really want to have, okay? Like, they think that, yes, I learned how to function because people constantly say, how do you keep going despite? Because I do take self-care. Because I had got when my son was sick, I became sick.
yes.
Started getting an ulcer. I was sick every day. And it took a mental health specialist that saw me constantly coming in there checking on my son, and he'd be in a facility. I came every day. He said, ma'am. And he sat me down. He took me in a room. I was there for my son, but 3 of the doctors came and sat me down, and they said, listen, you're going to be sick. You're not going to be able to, he's not going to be 100%, but you can get him back okay, but you're trying to make him be normal like he was. And I shouldn't say normal. I really have to watch my words, but back to the son that you knew before he became sick. And he's not going to be that person, but he'll be okay. But we're watching you, and we're more afraid of you getting sick than him. And it wasn't until then that I started like really paying attention. That's really why I got into the whole love yourself. That's why I named my business Love Yourself, because you have to heal yourself first. They say your cup runneth over and your cup runneth over. See, if your cup is full, the runneth over part is the part you help other people with. You gotta, if your cup is not running over, you gotta stop because you gotta fill your cup up. That's for you. Like, that's something that I think that when I go get a massage or go get my nails done or pedicure, people look at you like you bougie or something. No, I'm taking care of myself because I have to make time for myself. Sometimes I'll just go get a hotel room and just go sit in a hotel for one day, drive somewhere. I've driven to Columbus and just sat in a hotel room by myself and just had peace to reset. But we don't we got to take care of ourselves.
So when you take a flight, what's the first thing they tell you?
Put your
You have to put your
first
oxygen
before you
on
help your
your
neighbors.
Yes.
You have to take care of yourself, period. And I tell people, if everybody who dies has something to do tomorrow, you know what I mean?
That's good.
So
Yes.
you
That's
take care of yourself.
Yes. It's important because if you don't take care of yourself, like you said, you can't be there for other people. But you do things. I tell people all the time, do things that make you feel good. Don't worry about what other people are thinking. Do things. If it's get your hair done, if it's buy you a new outfit, if it's just to go to the library and sit there, we have to find time for ourselves because that's how we create good mental health and good self-care. It's important. It's like medication. To me, self-care is medication.
I need to improve on that area. Sometimes with my job, I'm on call, I work weekends. One time I worked like 24 days in a row.
Wow.
And I work with these beautiful LPN twins, Ree and Day at Highland. And one of them said to me, "You need to do better self-care." And I said, "What do you mean? Do I not look good?" She goes, "You always look good." She goes, "But I've noticed that you've worked like 20 days in a row." And I lost count. I said, "Really?" She goes, "Yes." She's like, "So how are you going to take good care of your patients if you don't take care of yourself, Miss Brandy?" And I said, "You know what? You're absolutely right." She goes, "So on your off day, I want you to do something good for yourself." And she's like, "And I'm going to ask you what you did." And I'm just so happy to work with people that notice that notice me and that encourage me to take good care of myself. Because it's so easy to go on autopilot. Because we're mothers and I'm a nurse and I was a critical care nurse and I could work 12 hours and have a steel bladder where I don't need to pee and I don't need to drink and I don't need to eat. That's nothing to be proud of.
No,
You know what I mean? That's
it's
like,
not.
okay, well, you need to calm down too. You need to take care of yourself too. And it's like, that just made me think, she cares about me. She's watching me. So let's watch each other. Let's look out for each other and say, hey, you need to just take a couple steps back. And when I see I'm getting animated about something, I'm going to put it that way, about work. I have a physician friend of mine. Her name is Dr. M. She goes, "Now, come on. Don't get your blood pressure up and don't get any wrinkles in that pretty face. You're 10 years old younger than me, and I want you to stay looking like you're 30. So she's like, "Just take a deep breath and calm down. Everything's going to be okay." And she's right. We want to fix everything. We want everything to run smoothly, but that's not life. So give yourself a little grace.
And I love what you said, Brandy, is to notice each other. So I have a 22-year-old daughter, and when my daughter was 17, she got extremely depressed, and I didn't notice at first. She was in a senior high school. She was about to graduate, and like around the December before that, she had started sleeping a lot, and she was working a job. So I just felt she was tired. And one day, I found a knife behind her bed, and I asked her about it, and she told me that she was thinking about it, and she wound up going into a hospital and spending a few days there, and it was for me. From that day on, I noticed her. I make it a point because sometimes again we look at people and we say, "Well, you have a great life and everything is good, and you're entering into a new stage in your life, and you don't want for anything. You're not, your life is great, but that's not it." And so when I begin to notice, I notice when she's having those moments, and what I tell her is that some things just normally make you feel good as a woman. So when she gets in those positions, I tell her, I notice when she doesn't get her hair done or when she doesn't get her nails done, and it's like, okay, I know what's happening. She's not in a good space. And so even and then I can communicate with her because I notice, right? And I'm not just blind to, oh, this is not going on. So we also have to notice people and understand. Because I think when we were having dinner, wasn't we talking about that? Somebody noticed that you hadn't got your nails done or you hadn't got your hair done, and they were like, hey, what happened? And so even noticing that in people and bringing it to light makes them feel better.
That's real, because I'm gonna tell you, that's the first. If I don't get if my hair is not done, help me, y'all, help me. Because I have a hair fetish for real. Like, but that's serious. It's simple things. Like we have to look at the simple things. Pay attention to people, like your loved ones, your friends, because it takes a village, guys. It takes a village, and it's so important. That's why it's so important to have good people in your life and not to have them negative people. I don't even, if I answer the phone and you start talking about such and such said, I gotta call you right back, because you have to protect yourself and really pay attention to what you're letting in your life. And then get rid of them friends that you know is not a friend. Okay, I'm keeping it 100. I don't even deal with you. You're not a real friend. I'm not, because you're not going to be what I'm going to be to you, and you're not going to be able to help me when I need you. And so you really got to pay attention, and people got to stop saying, I don't need nobody, because you do. Everybody needs somebody to love them. A lot of people that I see that go through a lot of mental health, they don't have a good support system. Like, I'm super blessed, and thank God. I thank God every day. Sometimes feel guilty that I have like an amazing mother. because I could tell right away when somebody did not have the best like mother, because nurturing and all of that is a big part of our mental health. Feeling love.
Yes.
Love is a big
Appreciate
factor
it.
in mental health. Like, if you don't feel love, you feel lost. You're like, it's a big deal. So, just being able to be something for somebody, you don't have to be a doctor to know that somebody's off track. Show a little love, like do a little something nice for people. It's big. I'm big on giving back to the community and giving back to, domestic violence shelters, everything. Like, when I go to the domestic violence shelter, I literally, people come in with food and they just drop it off. I go and sit down and talk to the ladies because they just want to connect with somebody that can feel their pain. Like, so the people that crack me up and they're like, I did this, and they want credit for just keep dropping off food. Go talking to them and having a conversation is way better medicine than just dropping off something and saying, here goes some shoes and some clothes. Like, we got to really get deeper and really care about our community, because I mean, we're one of the most powerful beings on this earth. We're very intelligent. We can come up with all kind of things, but we just don't want to touch mental health for some reason.
And being kind and loving strangers and giving somebody a smile. I look for ways to compliment people.
Yes.
I look for ways to make somebody smile, because that's what? Being kind and loving is free. It doesn't cost me anything, but it gives me so much in return, because it makes my day to put a smile on somebody's face. And I know people are like, really, what are you talking about? But just try it, because that's what's wrong with our world today. People are so into themselves and they don't love themselves. And again, that's why the crime, it's not just poverty. Because, our ancestors were always poor, right?
Right.
We come from slaves, okay? So it's not about just poverty. It's about self-love and self-worth. And if I don't feel like I'm worth anything, your life means nothing to me. That's why these young kids can pull out a gun and shoot somebody.
That's why I say they don't have nothing to live for. They feel like this young, everybody keeps talking about this a lost generation. Well, guess what? We have a responsibility to help them find themselves.
The whole system has failed them.
Yes.
It's not
really
just
has.
the whole entire system has failed our young people. And so when we have people like us who are a partner with us, and we reach out and we give that love and we give that support and we mentor our young people, it makes a difference. I read one time that if you have a baby and you can feed your baby, if your baby's in a crib, you can feed your baby, change your baby, but you don't hug your baby will die.
Oh, yes.
That is the connection that we all need.
I had a patient that I took care of last week who his mother died in childbirth. And he never had that skin-on-skin bonding because she was gone. And he is 24 years old and suffering in every way possible. And he can identify why that is. Now, his stepmother is very loving. She adopted him. She loves him. But he did not get a chance to bond with his mother at birth. So that is a real human need. And he is suffering mentally, physically, and spiritually.
And that goes back to even, on the nursing side of things. Because when that happens, you do have some nurses, in instances like that, who will take the time out to do that skin to skin, so they can feel the nurture and the love that the babies need. But when you're just shuffling through or getting through your day, the end results is like this 24-year-old.
Nurses are really important.
They are.
I mean, seriously, because the patient sees the nurse. When you're in the hospital, I saw this. Like, when you're in the hospital, the nurse is spending a lot of time with the patient, way more. The doctor come in 10 minutes, if that. Okay? And so I've watched, like when my grandmother was in the hospital, I've seen people, they do better when they have a nice nurse, because your spirits are up, because your mental state of being is everything. That's healing. You could get through something like, they're going to give you a diagnosis, you're going to die. I've seen this with a lady that I worked with. She had cancer, and they told her she only had a certain amount of time to live, but her mental state of mind was, I don't care nothing about them. I'm going to live. And I promise, I believe that she got through that because she mentally was strong. Like, I'm not giving into that. And she was telling us all the time about the nurses who were so nice, and they kept giving her hope and strength. And then she told us about the nurses she couldn't stand, who just came in there and signed off. So, you guys are phenomenal. We need to clone all three of y'all.
When you're in that position, though, And it's so bad to say, but it's the truth. A lot of people get into positions for money.
Yep.
It's not about the human side of it. It's not about the human connection. And these aren't positions that you can't have empathy.
No.
It's just not. The money is good, but what are you doing to help humanity?
I worked on a critical care unit where I took care of ventilator patients and patients that had cardiac problems. And I used to, as I was going through nursing school, I would work every weekend at Kindred Healthcare on Fair Hill. So I got one of my patients rolled over on her side, giving her some incontinence care, and I'm rubbing her back with lotion, and I'm a singer, and I would sing to her. And she was very confused, but she looked over her shoulder. She goes, "You're not from here, are you, baby?" I said, "Well, why would you say that?" She said, "Because you're taking the time to give me a back massage," and then I rubbed her feet. She was like, "This can't be real," and it gave me so much hope, because it was like, I could tell that she needed that. Mm-hmm. And when you're sick and when you're suffering, that hands-on and that human touch, it goes so far. And she was just like, "You're not from here." And I'm like, she's confused. What is she talking about? And the young lady, the nursing assistant, was helping me. She's like, she recognizes that, you probably are here once a week. You're not burnt out. You're not frustrated. You're not rushed. Because I could tell when I took her socks off, there was like what we call skin snow in the air, flakes of skin just everywhere. And her her feet were so dry and so cracked. I said, "I'm gonna wash between these toes. I'm gonna lotion and massage her feet." And just that few minutes, it took me maybe 5 to 7 extra minutes, gave her so much joy. Mm-hmm. I sang to her, I sang Amazing Grace, and I rubbed her down a little bit, and
that's beautiful.
It like I said, it gave her something, but it gave me something too, because that was the highlight of my day. It was really the highlight of my day.
So I told you guys about a situation that I had to deal with right before the show started, where a good friend of mine, I'll stop saying friend, I said family, friend, sister, son passed away this morning, and he was like 24 years old. When something like that happens, what advice do you give to a mother? Like, I'm thinking, I have no words, and I always have the right words. I feel like I always have some words. I'm lost for words. What would you suggest, like, be her first thing that she does after losing her son? Like, what?
To do nothing.
Yes,
to do nothing.
I was going to say
to do nothing.
Do nothing. Just sit.
Just sit.
You don't have to. You don't have to. And you can go and sit and do nothing.
And
you don't have to have you don't have to have the answer.
Just hold her hand.
Yep.
Let her know that you love her.
Absolutely.
And that you're uplifting her in prayer. And that when and if she needs to talk or whatever she needs, that you're there for her.
So she just needs to just sit still.
Just be still.
And
then eventually
allow the emotion.
She should get some help though.
Definitely.
Definitely.
Cornerstone of home.
Cornerstone. Like, that's what I was gonna ask you. What are some places that she can go?
Cornerstone.
Can y'all tell, like, the audience, places people can go to get help and how hard? Okay, let's talk about medical care, because some people tell me, "Well, I can't get therapy because I don't have any medical insurance." How does that work?
So I just started taking individual clients on this platform called Grow Therapy, where I'm just getting credentialed with certain insurances. I had a lady reach out to me where her particular health insurance wasn't covered, and she was able to pay out of pocket. Okay. So I understand, typically I see patients $120 for a visit. I work it for you, where if you can only afford to see me once a month, we'll do what we need to do within once a month. But you have to invest in yourself. Your mental health is like currency. And if you don't take care of it, it will take care of you.
Please tell people about how can they get in touch with you?
I don't know if we can put something in the chat.
I'm gonna do that, and Marie will put that on our No Static Radio page as well.
Yes.
But if for the people that are listening, and then I will go back and I'm gonna put it on the page, and I'm gonna all of you give me your information, and definitely on your platform. I know you were telling us about this new platform. I'll share it with
So there's certain insurances, it takes some time to get credentialed, but there's certain insurances that I'm already credentialed with, but if not, you do have the opportunity to pay out of pocket. I try to keep it short and concise. I work with you as to what you can afford. We build your treatment plan from there. I will do a comprehensive psychiatric evaluation, look to diagnose you, look to see what your symptoms are, create a medication plan, link you with some therapists. That way you can continue to get individualized therapy, whether it be with me or someone else. There's a way you can go to the intake department and they will run your insurance and they'll determine if you are already someone we can see through the insurance that you have, and if not, then we can worry about, you paying out of pocket and what that looks like. But
does Medicaid pay for mental health?
a lot of times, a lot of providers do not take Medicaid, which is sometimes
See, that's
very
sad.
hard.
So someone that, let's say, getting government assistance, it's harder for them to get mental health care.
But there are organizations that gravitate towards that.
Okay.
So, we just, with you working for
So
the Adams
the
Board.
Adams Board, and actually, the Adams Board just, there was conversation surrounding trauma and police brutality. There were conversations they had. The Adams Board actually is funding some different therapists for people who have dealt with trauma, and they can go and talk to them. So the Adams Board doesn't provide direct services, but they can definitely, they have a directory of people who will provide services.
Okay. Then you mentioned Cornerstone.
Cornerstone of Hope is like a grief. It's supposed to be like the best grief counseling ever.
Yes.
Cornerstone of Hope, guys. That's one.
And one good thing about Medicaid in the state of Ohio, as far as psychiatric medication, it is easier for you to get coverage having Medicaid than private insurance. So please, even though it might be hard for you to get a provider, once you get linked with an appropriate provider, your medication will be covered. And we can do a lot of the long-acting injectables, some of the newer medications, because it's just for whatever reason in the state of Ohio, Medicaid is able to cover a lot of these meds. So just reach out, don't give up. I mean, if I'm not appropriate, Rashonda might have resources. We'll link you to what you need. We'll find resources for you. We'll make referrals for you or give you suggestions. But just ask for help.
Because we're created to live an abundant life, and that's just not financially. That's holistically. It's mind, body, soul, and spirit. And that's what we want for everybody, because we don't want you to suffer alone or feel like you're alone, because we know what it's like. A lot of us have dealt with it. Believe it or not, we're all interconnected. It may not be us, but we know somebody who knows somebody who knows somebody.
Absolutely.
And so we want you guys to get help.
And if you don't ask for it, you don't know what's out here.
So listen, we are going to do a part 2 because there's no way we got enough information out today. I want to dig way deeper into this. But I got to ask y'all something. Because you guys have this whole intense job that you do every day, you're saving lives every day. Like you can put on a cape every day. You get up every day and you go and you work. What the heck do you do for fun outside? I just want to let's get to know, like, y'all amazing, but what do you like to do for fun outside of work? We just go down the line. What is something
I'm a
you like to do?
singer-songwriter, so sometimes I write songs and I sing. When I'm stressed and I come home from work, it's like a concert. My family's like, "Oh, she's singing again," and I love to travel.
And she can sing, y'all. New artist alert.
So I love to sing. I love to create. I love to travel and cuddle and snuggle with my husband and watch movies. And
Recently married?
well, we've been together since 1999. We
Forever.
recently got married February 14th of 2022.
Okay, congratulations.
And I love him more and more every day, and he is my rock. I feel like I can
That's
get through
amazing.
anything with this man by my side.
I
really.
love black love.
And I love him more every day. I go to work, I'm like, I wonder what he's doing. I miss him so
Oh, I
much.
love that. We need to hear this. We hear all the negativity. Like, that's great. I love it. You giving me hope, girl. I want some of this. I want some of this.
He's my biggest supporter. He looks at me and I can just see the love in his eyes. He makes me feel beautiful. He makes me feel smart. He makes me feel like I can do everything and anything in this world. And I just love him so much. And I feel so blessed to have him in my life. And I thank God every day for him.
Shout out to the good brother out here being a good man, giving us some
William
good
Hill.
love. All right, William, where your friends at? No, I'm just kidding. I'm just kidding. I got a little love going on right now. I want my love to be like your love. Listen, love, I ain't gonna say your name. You need to, this is what I'm looking for right here. This is goals, okay?
Relationship goals.
Relationship goals. So what's up with you, Tiff? What's your what that shirt say? What's the shirt say?
It says Smoking Wheels.
Smoking Wheels.
Yes.
So tell us a little bit about Smoking Wheels.
So Smoking Wheels is our new mobile cigar lounge.
Congratulations!
Thank you.
So that's gonna be some of my self-care with Smoking
Yes,
Wheels, okay?
yes. So when we battle on the field coming up, Cincinnati, she's a Bengals fan, and my Browns.
Poor Browns.
Yes, but that's what I like to do. Actually, I love football. Anybody who knows me knows I'm a football girl. So this is our season coming up, football season. I love to travel. I love being with good people, you know, and I am a nurse, so it's not very healthy, but I do love to indulge every now and again.
And cigars, right?
Cigars.
So you have a mobile cigar lounge.
Yes.
Called Smoking Wheels.
Smoking Wheels.
That is awesome. I can't wait to have an event on here.
Yes.
Me too. Invite me.
Yes.
Yes.
You know you there, y'all.
Right.
We gonna have a launch of our new project, okay?
Yes.
So that's awesome. So that's good. You have some
you.
great hobbies and congratulations.
Thank you.
Yeah, because a lot of people see you as one way. People have stuff going outside of work, you know. So that's awesome. And what do you like to do, Miss Rashonda?
So I too love to travel. I love it absolutely. Going on a cruise next week.
Oh, wonderful.
Yes, so that's gonna be awesome. I love to travel. I also love jigsaw puzzles. Can y'all believe it? I love
my
jigsaw.
grandma used to love
Yes,
that.
I love the good. I just brought a new one actually, so I'm just opening it up and getting started. But that makes me, that gives me peace. Spending time with my family, my faith family, absolutely love it. Just loving life and taking care of me and not letting anything stress me. Really, not letting anything stress me. Yes.
Pass that down to your sister.
Absolutely. So also my husband is wonderful. Just like he's actually my cousin too. He's Brandy's cousin too. So we
black love. We got some black love going up in here.
Very supportive man. Just will do anything for me. My biggest fan, my biggest cheerleader. So I absolutely love it. I also have a book, you guys. So
okay, tell us about the book.
So my book is actually journeys through a young girl's life of trauma. And it's called There's No Place Like Home. You can get it on Amazon or through my website. And Tanya will put that information up. But so just love what I do. I love helping people and just being there and building back the relationships that have been damaged because of a lot of things that we go through.
Okay. So you all, what made you all like as being young? Like in my purpose, I was always like giving back in the community, doing stuff like turkey drives. I was youth leader at church. Like I was always purpose driven. I knew I was gonna do something in the community. It was just like my passion. I don't even like as a kid. My mother, I used to get on her nerves. We would leave church and I'd be like, "Ma, that little girl don't have no shoes." And I'm like, "Can we buy her some shoes?" You know how something's just in you. Did you always feel like you wanted to be in the medical field?
So I was gonna sing and act on Broadway. That was my dream.
She's still gonna sing and act on Broadway.
And I started having children at 17. So I went to my guidance counselor because I had the opportunity to graduate a year early. I doubled up my junior and senior year because I've always been like a straight A student.
Wow.
And so she's like, "Well, what do you like to do?" And I've always loved, and I get this from my grandmother, rest in heaven, Alberta Brown. I always loved to care and nurture people and uplift people because I got it from her, And I told her, she's like, "Well, you're good at," my guidance counselor was like, "You're good at science, you're good at math." And I said, "I think I want to be a nurse." So I became a nurse at 21 years old.
Wow.
And so I've been a nurse since 1996. And I just kind of just loved it more and more every day. A lot of people get burnt out. I got inspired and I was an LPN for 20-something years, became an RN. And then from there, it's like the last 7 years, I became RN with my bachelor's degree. Then I got my nurse practitioner. And I look back and I'm like, wow, it still doesn't even believe like this is my life. I did this. So just loving and nurturing people and always wanted to be a caregiver. And so I will sing and act on Broadway one day. But in the meantime, I have this wonderful career where I can empower and uplift and love on strangers.
Did you always want to be a nurse?
No, I think I wanted to be a cosmetologist.
Okay. Now, see, she like me. She always got something going on with her hair. You don't know what Tiff gonna have. Every time I see you, it's something different.
Very recent. I wore my hair very short for a long time, just a short cut. So, but I'm having fun with the new looks. But yeah, I think that was my first go-to is a cosmetology, and then my god sister, she was going for phlebotomy, and I was like, what is that? And so I said, well, that sounds fun. And I went to medical assistant school in 1996.
Just kept going.
It just kept going from there. It's a passion, a learned passion that I had. And I think I'm a nurturer anyway. I'm an only child, so we always
got that in common.
Yes, yep. So we always around people and catering and nurturing. So yep.
What about you, Rashonda?
I actually wanted to be a lawyer.
Okay, you have the lawyer look.
Yes.
I actually wanted to be a lawyer when I graduated from college. Though my LSAT score wasn't as high, so everybody say, "Oh, girl, you need to get a city job." So I went down to City Hall and I found and I actually was a 911 dispatcher for 22 years.
Wow.
I was, and so that wasn't my first passion, but then as working in that, I grew to love it and to understand that people are really suffering and struggling. So when I left there, God told me to leave. It was time for me to leave after my 22nd year. And I left, and then I started dealing with trauma just because of things that in my past and people that I know in their past. And it just became such a passion for me to understand what happened to people that's causing them to behave the way they are. What happened to you? So it's just been there ever since. And this has been about 4 years now since I transitioned from that.
Congratulations. So if you have one thing you want to leave the listeners with until we get to part 2, what would you like to say to anyone that's going through anything right now, mental health wise, or just life, whatever tip? What was something that you would like to just your final word today? What would you like to share?
You can get through it. You can have a good quality of life. Don't give up. Reach out. Help is there. We love you.
I would say that you have to be an advocate for yourself, for your own health, and just like she said, just ask for help. Just ask and have that circle of people that you can trust and depend on. That's going to be there, and you'll see things change from there. Just try it and see what happens.
And I just want to say that you're not alone. You may feel like it, you may think it, but you're not alone. If you begin to talk to people, you'll realize that everybody has dealt with something. And it may not be too far from your street. It might be next door to you. So just being willing to open up. Don't be afraid to trust. And I think we've lost that. We're so afraid of judgment. But you're not alone.
Thank you. I really appreciate all of you coming here today. And thank you for your energy to keep me going because I called Tiffany and I'm like, I'm in the parking lot. I don't think I can do it. But it was something in my soul. God was saying, you got to keep moving. This is not about you. This is about your community. This is about other people. And everything about Real Talk with Reese is me, talking about real issues. But I never want to talk about an issue if I cannot provide a solution. And I think that's something we got to do better in the community. We got to stop talking about things instead of trying to help what's going on. We love to say somebody's not doing something right or not. Okay, well then how can you help them get on the right path? I say that the reason why a lot of people are lost in this world and can't find that path is because they don't know why they were born, what they were born to do. If you focus on what you were born to do, which means you have to find your purpose in life. Is that easy? No, but find that thing that you are really good at doing. If it's you love to play video games all day, then maybe you want to get into the technology side of it and create a video game. If you love playing in your friend's hair, then maybe you want to be a cosmetologist. If you just like, talking a lot, maybe you want to be a radio personality. But find that thing that you're passionate about. If you're really passionate about something because you do it all the time, that's your God-given purpose. Focus on your purpose and everything else flows. You got to let go of caring about what other people think. When you walk and talk and live in your purpose, I promise you, life is better. It gets better. You relieve the unnecessary stress and things that you put on yourself because you're worried about what somebody say. Don't worry about that. Don't focus on money. Focus on happiness. And I think Rashonda said this, and I say it all the time. We're all created. God created us, right? And He's great. So we're all created from greatness. But He wanted us to be abundant. He didn't create us to sit here and struggle and be upset. So look at what's going on in your life. Find that thing that makes you happy and live in that. And I promise you, everything will get better. Life will get better. Love on each other, y'all. Love on each other. Show somebody some love. I challenge everybody this week, in this month, to go out and do something nice for somebody for no reason. The other day I was at the gas station and I just put $10 on the girl next to me because she put $5 in her tank. I knew she needed some more. You know what I mean? It's little things like that. You would have thought I gave this girl $100. She was so happy, and I would have did more. I had $10 cash. I just gave it to her, but whatever. It doesn't matter if you only have $5 and you help somebody. It matters if you only have $1 or just a hug or a smile. Like Brandy said, smile. Say something nice. That goes a long way. And so, give back. I love you guys. We're gonna do a part 2 to this mental health because we gotta go. We might need a part 3 because we got some game changers in here. These ladies are living testimonies that what they do can help, and just going out and just getting some help and seeking help is going to get you in a better place in life. And so I just want to say, everybody tap into each other, okay? And then forgive me because I couldn't think real good today, y'all. My words weren't flowing the best, but I'm here, and I did that out of love. And so, to anyone that has lost someone, sit still, be quiet, because that's the advice that I just heard, so I'm going to give it to you guys. And if you don't have the right words to say to somebody, your presence is everything. So, until next week, Real Talk with Reese. We will see you next week, Saturdays 1 to 3 on No Static Radio, the voice of the revolution. And I will be tagging, and I'm going to do it multiple times this week, showing you how to get in touch with these ladies and then some other places where you can find mental health assistance. All right. Peace and love, y'all.
Bye.